Hello and welcome to another intensivecarehotline.com and intensivecareathome.com live stream. Thank you so much for joining me here today, and also want to welcome our viewers that are watching this on replay. So thanks again for all your support. Now, before I go into today's questions, just a little bit of housekeeping. You can type your questions into the chat pad, or I can also invite you live on the stream here. I can send you the invite in a minute, and then you can participate here live on the stream. You don't have to go on camera. I do appreciate if you can get on camera. Sometimes there might be some connection issues. If you do join me here, then I obviously need to stop it, because otherwise it's not a good quality of the recording. But if the connection is fine, we'll just continue chatting. Now, before I answer your questions that came in this week, or answer your questions on the call here, what makes me qualified to answer questions for families in intensive care? So my name is Patrik Hutzel. I am a critical care nurse by background. I have worked in critical care for over 20 years in 3 different countries. I have worked as a nurse manager in intensive care for over 5 years. I have been consulting and advocating for families in intensive care for over 10 years now as part of my intensivecarehotline.com consulting and advocacy service. I'm also the founder and managing director of Intensive Care at Home, where we send intensive care nurses and intensive care doctors into the home for predominantly long-term ventilated adults and children with tracheostomy. And we have been doing so for over 10 years here in Australia, but we're also consulting families for similar type services in the US and in the UK. Now, without further ado, let me read out the first question that has come in this week. And then if you have questions, type them into the chat pad. If you have questions, type them into the chat pad, and I can also get you on the live stream here if you would like. I'll post the live stream here. So if you want to join me on the call, just use the link that I'm posting here now. I hope you can see it. Just use that link. In the meantime, I'll read out the first question that came in. And this question is actually from Mama, who says, hi, Patrik, I might not be able to join tomorrow's live stream, but I have 2 questions. If you can help me better understand them, I appreciate it. Number one is about how to get medical records from the hospital. The hospital is denying giving me access due to the HIPAA policy, but I read under Family Healthcare Decisions Act, they should, although I don't have power of attorney. Are you aware of this? Also, I sent a complaint to HCRR. Do you think that they can help with getting access to my brother's medical records anytime soon, or will that be a solution that might take too long? Okay, so here is my suggestion to your first question, Mama. You and I have spoken on the phone before. No, not on the phone. We've spoken actually on Zoom. So you may not be the medical power of attorney on paper. However, here is my experience, and here is what I know about your case. You have given consent. The hospital has asked you to give consent to procedures for your loved one. Okay, they've asked you to give consent to a tracheostomy. They've asked you to give consent to surgery. They've asked you to give consent to a PEG tube. They've asked you to give consent to what could be life or death situations, right? And now they can't give you medical records. Can you see the irony of that, right? So also, if they're asking you to give consent to, doing a tracheostomy, PEG tube, and any other things, I believe the loved one was also on dialysis. So if you've given consent to any of that, how can you make informed decisions, have peace of mind, control, power, and influence if you don't have access to the medical record? So it's almost like double standards from the hospital's point of view. You know, they want you to give consent so they can treat your loved one, but they don't want to give you access to medical records. Now, I have seen similar situations over and over again that, you know, very few people when they go into hospital have their powers of attorney attached to them. Of course not. You know, well, when I say of course not, it's just not reality. Let's put it that way. And that was the case in your situation as well. So why don't you, you know, just tell them, well, how can I keep giving consent to things you're asking me for and without you giving me access to medical records, right? Again, I argue that just as much as HIPAA policies access includes access to medical records, you know, HIPAA policy also includes that a power of attorney needs to be able to make informed decisions, right? And you can only make informed decisions if you have access to medical records. Now, here is also what I would recommend, Mama. Again, you may recall that from our Zoom call, that I would consult a family lawyer here. A family lawyer will sort out the whole power of attorney issue for you, right? I'm not a lawyer. I'm a clinician. I'm a clinical advocate. But usually a family lawyer can sort out your power of attorney issues, right? That's what I would do if I was you. Okay. In terms of, do you think that your complaint to HCRR will make a difference and getting access to your brother's medical records sooner, or will that be a solution that might take long? Well, here is what I think. In this situation, you probably do need to make a complaint, but I'll give you another sort of hint in terms of you need to keep the pressure on, right? You need to keep the pressure on, especially with the view that they ask you to give consent to medical procedures and they can't give you access to medical records. That's the angle where you need to come from and how you need to advocate, right? It's as simple as that. Now, also, another hint here. Let's just say, God forbid, you would take this situation to court, because you feel like they're not helping you, you can't get access to medical records, and you would take it to court, you would take it to a lawyer, or, if do you think that the hospital would deny access to medical records to a court? Always approach it from that angle and think about, when would they give medical access to third parties? Well, they certainly couldn't deny giving access to medical records if this was to go to court or anything like that. Always approach it with the mindset of, well, I'm entitled to get access to the medical records. Always approach it with that mindset, right? And you will see what happens. I would keep the pressure on. I do believe you have been too nice there. I'm all for making friends if you can, but I wouldn't take any prisoners either, and I wouldn't take no for an answer here, right? Now, moving on to your next question. As the medical team don't see any improvement in my brother's health due to severe brain damage, they were suggesting hospice. Can you explain what we can expect from care in hospice? Yeah, I sure can. Hospice is maybe a euphemism for end-of-life care. So if your brother was to be moved into hospice, it's the synonym of palliative care or end-of-life care. What they will probably do is they will probably stop ventilation, mechanical ventilation. They will probably stop dialysis. They will probably stop all life-supporting treatment. And they will start him on comfort care, which includes giving drips such as morphine, midazolam, maybe fentanyl, maybe propofol for comfort care. Now, because I haven't seen the medical records yet, you know, one could argue if they're doing that, that might be perceived in some eyes as euthanasia. As you are well aware, euthanasia is illegal in, you know, in the United States, right? And I just leave it there, making you think, you know, whether you think that's the right thing to do. It may not be euthanasia. I don't know all the ins and outs of your loved one's case. I know some of it because we've spoken on Zoom, but I don't have all the ins and outs. So it's just something for you to think about. If you are agreeing to hospice, what it means is your loved one is being moved towards end of life care, right? And you have to ask yourself whether that is what you want. And you have to ask yourself, will you approve that without having looked at the medical records and without getting a second opinion? Can you see it all comes back to the medical records? You know, they don't want to give you access to the medical records, but they're asking you for hospice, and you can't even get a second opinion if you don't have access to the medical records, right? Well, you can get a second opinion. You know, you can just hire me to talk to the doctors and nurses directly, right? That's the quickest way. But can you see the irony here? Not getting access to the medical records, and by the same token, they want your brother basically dead, right? There's a whole lot of irony there as far as I'm concerned. So what is it that you can't see in the medical records, and yet they want to move your brother towards hospice and end of life care? Think about that. Okay, so I hope that helps, and I hope that answers your questions. I will go into to the next question that has come in this week. Also, if you're here live on the show and you have questions, type them into the chat pad, or if you want to join live and ask the questions live on the show, just use the link, and then you can join me here live. You don't have to go on camera, you know, but you can go on camera, and then we can discuss your case live here on the show. You don't need to mention names. Anyway, so let's look at the next question that came in from Yarden, who says, my younger brother was involved. Hi, Patrick. My younger brother was involved in a terrible accident. He was sitting on the trunk of a car and his friend sped up and he flipped forward and landed on the back of his head. The doctors originally thought he was brain dead, as his bleeding was excessive with lots of pressure all over his brain, and because the bleed happened near the brain stem, they considered him inoperable. He is now in a medically induced coma and is unresponsive when they try to wake him up, but he moves on purpose. Right. And that was 5 days ago. Okay, well, that sounds terrible, Yarden, that, you know, your brother has been in such a terrible situation now, or is in such a terrible situation. Now, if he has purposeful movements, that means he's definitely not brain dead, right? If he had pressure all over his brain, like you described in your email, that means he probably had high intracranial pressures, or ICPs, right? And they would have treated that either by draining brain fluids, such as CSF or such as blood. They would have treated this potentially with hypertonic saline. They would have treated this definitely in an induced coma. They would have treated it with potentially with mannitol. They would have treated it with some type of surgery. You're mentioning they didn't operate on the brainstem, but maybe they operated on other areas of the brain to relieve the pressure. Maybe they did a craniectomy, i.e. a partial removal of the skull to let the pressure not build up to the point where, you know, it kills a patient. So he might have had a craniectomy. You can ask that. And they would have treated it potentially with also paralyzing him, chemically paralyzing him or restraining him chemically so it's not moving, right? They might have done that. He might have had a midline shift as part of the ICP, intracranial pressure increase. That means, the midline of the brain would have shifted left or right depending on the location of the brain, putting even more pressure on the brain, and once again, if there's pressure in the brain, if there's more than 3 minutes without oxygen, that could lead to severe and irreversible brain damage. Okay, that is what might have happened here. We don't know. But again, given that he's moving on purpose, that is a really good sign. Again, maybe you can let me know whether your brother is squeezing your hands if you ask him to. Maybe your brother, is he wiggling his toes if you ask him to? Those would be fantastic signs. Is he breathing? Like, is he breathing spontaneously, or is he still fully ventilated from the ventilator? Right. Furthermore, is he hemodynamically stable? Right? Is he on inotropes, vasopressors? Is he potentially septic? Right? Does he have an infection? Right? What is the prognosis from either the neurologist or from the neurosurgeon here? Especially with brain injuries, you do want to know what the prognosis is. Okay. So those are the types of questions you should be looking out for in your brother's situation. But, given that he's moving purposeful or has purposeful movements, you should be cautiously optimistic here that your brother can make a recovery. Don't let the hospital, bog you down with doom and gloom and all of that. Look forward to, your brother's recovery. I think you have reason for that. Okay, then let's move on to the next question. That's coming from Johnny. Johnny says, my frustration and challenge at the moment is medical malpractice. My mum was placed on a ventilator after supposed cardiac arrest. She was taken off the ventilator and placed back on it to perform some procedures. Now the next step is to place a tracheostomy, but the blood platelets are very low. They are 10 instead of 200,000. Wow. Okay. That's a challenge, Johnny. So she was taken off the ventilator and placed back on to perform some procedures. Okay, maybe she had an ablation. Maybe she had cardiac stent. Maybe she went into cath lab. And now she's back on the ventilator and they want her to place on a tracheostomy. So, and that would probably make sense, but blood platelets are very low, 10 instead of 200,000. So I'll give you my theory here, Johnny. I could be wrong, but I'll give you my theory here. Your mom had a cardiac arrest. She ended up on a ventilator because she lost consciousness. She couldn't breathe. They revived her successfully. They've probably then done an ultrasound of the heart. They've done some blood tests, and then they decided, they've done a 12-lead ECG, and then they decided she probably needs to go into cath lab for an angiogram. An angiogram is a screen of the heart, of the vessels of the heart, to look for blockages. Now, they found some blockages and they realized they need to place a stent or multiple stents potentially to unblock the arteries so that a cardiac arrest doesn't happen again. So they would have placed those stents and they would have needed to intubate her in the cath lab because she potentially became unstable when they did the angiogram. Because she became unstable, they had to intubate her. And then they were doing the stents successfully. And then they started her on blood thinners, such as Plavix, or maybe they started her on a heparin infusion because she's now ventilated. And now she's struggling to come off the ventilator because she had some procedures, and that's why they potentially want to do a tracheostomy. Now, when you do a tracheostomy, the coagulation screen of the blood should be within normal limits, i.e. APTT should be within normal limits, INR should be within normal limits, and platelets should be within normal limits. Now, the platelets are low. They're 10 instead of 200,000. That makes it very risky for your mum to have a tracheostomy because, you know, she would have a risk of severe bleeding if they did a tracheostomy with a platelet count of 10. I believe that the platelet count of 10 is a result of her having had the angioplasty and her being on blood thinners. This makes doing a tracheostomy very, very risky. Not impossible, but very risky. So here's what they probably need to do next. They need to give us some platelet infusion before they're doing the tracheostomy, or they need to give her FFP's fresh frozen plasma. Now, stopping the anticoagulants is a huge risk because if she has platelets, if she has an angioplasty, people that haven't had an angioplasty, it's basically a foreign metal body that's inserted into the coronary arteries. To keep them open and patent, you know, patients need to be on anticoagulation often for the rest of their lives. Another anticoagulant that I forgot your mum might be on is actually Clexane, right? So, then, but now she can't come off the ventilator for whatever reason. Well, if she can't come off the ventilator, you should be looking out for her ejection fraction. What is her ejection fraction? Ejection fraction is basically the contractility of the heart. Okay, look out for that, ask them for it. They must have done an ultrasound and they must have checked out the ejection fraction of the heart. If it's weak, if her ejection fraction is low and the heart is weak, that makes it more likely for her to needing the tracheostomy because she can't breathe up by herself and she can't come off the ventilator because of the weakness of the heart and the low ejection fraction. Okay. Now, the next question here that I have is, why does she need a tracheostomy? Can't she be weaned off the ventilator? Well, her heart supposedly might be fixed now with the angioplasties. You know, can't she come off the ventilator and avoid the tracheostomy? Yes or no? And if no, what are the reasons for that? So I hope that answers your question, Jimmy. But here's another question that is important. Are they trying everything beyond the shadow of a doubt to get your mum off that ventilator and the breathing tube? Right? Are they optimizing her condition? Right? Is she on inotropes? Is she on vasopressors? Now that she had the cardiac stents, is her ejection fraction differently compared to what it was like before the cardiac arrest or even on hospital admission? They must have done some benchmarking. Okay, so I hope that helps and I hope that answers your question. Let me move on to the next question. I'll also give you a tip. Go to intensivecarehotline.com and type into intensivecarehotline.com how to wean a critically ill patient off the ventilator and the breathing tube. And that'll give you some guidance in terms of what to do next when it comes to weaning off the ventilator. Okay, let's move on to the next question, or if you have any questions here, please type them into the chat pad or join me live on the stream here. I've posted the stream, the link into the comment box. So you're more than welcome to join or to post the questions into the chat pad. Okay, let's move on to the next question from Jessica. Jessica asks, hi Patrick, My dad has a tracheostomy and was in ICU for 10 weeks and is now being sent, now they want to send him to LTAC, where they said he will be weaned off the ventilator and have physical therapy. Nothing has happened and it's been 6 days and he won't open eyes. Wow. Okay, Jessica, you must be new to my YouTube channel. You must be new to my blog. I've been saying for the last 10 years, don't go to LTAC under any circumstances. And the reason I'm saying don't go to LTAC under any circumstances is simply that patients will not get weaned off in LTAC. Patients will not have physical therapy in LTAC. And here are the reasons why. So when someone is on a ventilator with a tracheostomy and is critically ill in ICU, right, they need intensive care, doctors, intensive care nurses, respiratory therapists around them 24 hours a day, right? And patients get that in intensive care, generally speaking. Now, if they go to LTAC, they'll have none of that, right? There are no intensive care doctors, no intensive care nurses, no RTs, or very sporadic, right? And you're going from a 1-to-1 or 1-to-2 nurse to patient ratio at the worst in ICU. You're going to a 1-to-4, 1-to-5, 1-to-10 overnight nurse to patient ratio without intensive care nurses, without intensive care doctors, without respiratory therapists that have intensive care experience. So that should ring your alarm bells big time. Big time. I argue that unfortunately your dad won't get off the ventilator in LTAC, and I could have told you that before he even went there, right? LTACs are the better version of a nursing home, and I would not have any of my family members go anywhere near to an LTAC, right? I would not have any of my clients go anywhere near an LTAC, and there's always a better way, right? Now, it'll probably go worse from here, Jessica. Two things. One scenario that might unfold here is that your dad will bounce back into ICU, as most patients in LTAC do, because they're not, it's not an ICU. Most patients go from ICU to LTAC based on finances, not based on clinical need, right? LTACs are designed to free up hospital beds, to free up ICU beds, and to save the insurance's money, but they're not designed for clinical need, let alone in the patient's best interest, right? So, so that's one thing. He will probably bounce back into ICU very soon because they can't really handle his clinical condition. Spoiler alert, if he does go back into ICU, there's a very high chance he will go back into an ICU where that doesn't know him. Basically, he'll go back into an ICU that hasn't met him before. And that means all of a sudden your dad would have been to the first ICU, to LTAC, and then to another ICU within a few weeks. That is madness from my point of view. Absolute madness. Now, to top it all off, if your dad won't come off the ventilator in the next 30 days in LTAC, all of a sudden they will start talking about a skilled nursing facility or SNF, right? That's what I'm saying. Your dad will go from bad to worse, right? So keep that in mind. I would advocate, if I was you, to get your dad back into ICU, and we can help you with that. You can hire us for that, right? We'll make a clinical argument by talking to doctors and nurses directly, by looking at medical records and doing a combination of all of that. That's how we will get your dad back into ICU, which is where he belongs. Okay, I hope that answers your question. Before I move on to the next question, once again, if you have questions, type them into the chat pad or come on live to the show. You can use the link that I posted below the video. It's called StreamYard, and you can see the link there. You're welcome to join me here live on the show. I will answer all of your questions. You can come on and ask them here. Don't need to get on camera. You can just stay off camera and ask the question. Okay, in the meantime, let's get on to the next question from, oh, that's actually the same question. Why is that? No, that's the same question. Sorry about that. I've got it doubled up here. Let's move on to the next question, which is a question from Jay. Jay says, "Hi Patrik, my mom is 71 years old. She had been on the ventilator for 4 weeks. They put in a tracheostomy and a feeding tube. She has been sedated a few times, which takes a longer time to come around than others. She has been sedated a few times, which will take her a long time to come around compared to others. She is responding to us with her eyes. She will smile or laugh at things that are funny. But the ICU team is saying it is involuntary and she isn't doing it for them. They said she can't breathe without the ventilator. We've asked to try different seizure medications, along with having a neurosurgeon to examine her and the shunt that was placed from a stroke in 2007. Right. Okay, Jay, thank you so much for sharing this with me. She has been, now your mom should no longer be sedated now that she's on a tracheostomy, full stop. Unless, you know, she has pending surgery or she has a brain injury and she needs sedation to manage high brain pressures, your mom should no longer be sedated with a tracheostomy. And it's taken her longer to come around than others. You think what makes you think it took her longer to come around than others? Waking up in ICU is often a process, not an event, i.e. it can take, you know, sometimes many days, sometimes many weeks. Okay. Now, the ICU team might be saying that her movements are involuntary. However, you know your mom and you can clearly see that she's doing it for you. Right? She may not do it for others, but she may not do it for the doctors or for the nurses, but she's doing it for you. That's all that matters really for you. They said she can't breathe without the ventilator. We have asked to try different seizure medications along with having a neurosurgeon to examine her. So, and the shunt that was placed from a stroke in 2007. Okay, so she must have some neurological condition. She must be on anti-seizure medications. Well, what happens if you took the anti-seizure medications off? Would she A, wake up? Because some anti-seizure medications such as phenytoin or Keppra actually have a sedative effect, right? Or, you know, why is she having seizures? And the shunt, you know, I don't know what's happened with the shunt. Is it blocked? Does that play a part? If the shunt is blocked, she may not wake up. Has she had a CT scan or an MRI scan of the brain? That's the question to me. If she has had an MRI scan or a CT scan of the brain, they would see whether the shunt is blocked or not, right? And maybe she needs simply a shunt change, right? So, but if you're telling me she's responding to you and your family with her eyes, she will smile and laugh at things that are funny. But the ICU team is saying it's involuntary, and she isn't doing it for them, right? So, I don't know what she's doing, right? But it's hard to say, right? It's hard to say what she's exactly doing. Talk to the neurosurgeon, right? Ask them for a CT scan or an MRI scan of the brain and go from there. That would be my advice here, Jay. Okay, just give me 1 second before we get on to the next question. In the meantime, feel free to type your questions into the chat pad or join me live on the stream here. I've posted the link in below the video. I'll post it again here if you like. You can call me or you can join me here live on the show. Oh, And you don't have to go on camera. You can just join me by talking to me, but you're also welcome to get on camera. Okay, here is the stream again. Now, let's get on to the next question in 1 second. I just do very quickly need to respond to a text that's rather urgent. Okay, just give me 1 second, please, before I get on to the next question. I'll be right with you. Okay, so now next question. Next question is from Tonya. Tonya says, "Hi, Patrick. I was wanting to do something like you, so people are aware. So people are aware of what is actually going on. One thing, my mom had donor on her driver's license. Another thing is she went in with a hernia. They turned around and tried to blame it on her COPD. And I knew that was a lie because she could walk circles around me and I don't have any breathing problems. So that's when I got on the portal because I felt something wasn't right." Okay, that doesn't quite make sense. Let me get back to this because I can see Christopher has a question here. Let me respond to Christopher first. Hi, Christopher. Nice to see you again here. Christopher, I'm just reading out your question. My mom is 82 and was on a ventilator for 2 weeks for a pneumonia. She also suffered a stroke while in the hospital, right frontal. She's been out of ICU for 2 weeks, has regained movement of her left leg, and is off medications. However, her alertness and cognition are still diminished. Does she have PICS? How can we identify the cause of her sluggish response? Okay, great question, Christopher, and thank you for sharing with me what's been happening. I know you and I have spoken. So, she's been in and out of ICU. She's been out of ICU 2 weeks. Okay. How long, Christopher, how long ago was the stroke? Can you tell me the date? However, I can answer your question anyway. What's the neurologist saying? Right? What is the neurologist saying? That would be number one. Because if you're wondering, how can we identify the cause of her sluggish responses? Right? Well, that is a question for the neurologist. You don't know. Okay. I see. Okay. Christopher, I have not heard of PICS. What do you mean with PICS? I'm just trying to Google this. I'm sure there's a synonym for that. PICS, post-intensive care syndrome. Potentially. She might potentially have post-intensive care syndrome. However, her not waking up is most likely a result of the stroke. Most likely a result of the stroke and the combination of her being sedated for quite some time. I remember when you and I spoke on Zoom, she was sedated for a few days. Post-ICU syndrome. Yeah, I get that. Yeah, no, you definitely need to talk to the neurologist as a matter of urgency. Another thing that would be important to know, Christopher, was it an ischemic stroke, i.e. caused by a thrombus, or was it caused by a hemorrhagic stroke, i.e. caused by a bleed? Okay, those are questions that would be important to ask Christopher. Now, here's my next question. Are they doing active rehabilitation? Are they mobilizing her? Is she getting stimulation? Right? Are they giving her good nursing care? Are they, washing her, potentially getting her to a shower mobilizing her, getting her into a chair? Are they talking nicely to her? Are they encouraging her to do things? All of that is very, very important in situations like that. Right? Also, with the seizures, is she at risk of, with the stroke, is she at risk of seizures? If she is at risk of seizures, are they giving her anti-seizure medications such as Keppra, such as phenytoin? Because if they do, that might also make her sluggish depending on the doses she's getting. Okay, so you are saying, Christopher, she's awake, but her responsiveness is very sluggish. She is getting physical therapy, but very limited. Sitting at bed, I do talk to her and she seems to understand. Okay, good. That's good. That's a good sign. That's a good sign. Now, Christopher, I'll give you a hint. There is a blog called icusteps.org. Okay, shout out to icusteps.org. It's a blog for ex-ICU patients, and you can see what ex-ICU patients describe their experience and so forth. Right? I encourage you to read that, to see what patients post-ICU go through. Right? Your mum may well recover, but she will recover in her own time. She's not ready for a speedy recovery for whatever reason. It'll probably take some time, nurturing, encouragement, lots of physical therapy, lots of mobilizations. It'll probably take time. So, Christopher, you're saying no mention of anti-seizure medication. Stop the antivirals and antibiotics the last 2 days. Okay. Well, just because there is no mention of anti-seizure medication doesn't mean it's not there. Right? Here is another hint, Christopher. How is her kidney function? How is her liver function? So the reason that might be important is if her kidney function or her liver function is impaired, right, she might simply have difficulties metabolizing or excreting the sedatives and the opiates from the past, slowing the waking up down. Okay, so do you know if she's, if her kidneys and her liver are working 100%? The other thing that comes, or that might come into play here, Christopher, is lost my train of thought now. Kidneys are good. All blood work looks good, except red blood cells are low. Okay. Interesting. Well, okay, Christopher, has she had a CT scan of the brain or an MRI scan of the brain? And if yes, what does it look like? Right? That would be important to know. Has she had a CT scan or an MRI scan of the brain post-stroke? Has she had an EEG? Right? Those are questions that would be important to ask. Okay. Other than that, Christopher, it is often simply a matter of time. Right? It is simply a matter of time. Yes, several MRIs. Last one about 8 days ago. Nothing new. Okay. Right. Christopher, I do believe you urgently need to speak to a neurologist. Now, you're also saying she's passed the barium swallow test, but not swallowing food. G-tube scheduled for Monday. So that's good that she's swallowing, because if she's swallowing, one of the side effects for a stroke is often people can't swallow. Okay. And that's often one of the side effects. So that's a good sign. In terms of if she can swallow, why would you schedule a PEC tube if she can swallow? Why would you do that? I tell you why I wouldn't necessarily give consent to a PEC tube. It'll give them the option to send her out to other places. Now, and that might be the right thing to do if she can go to a stroke rehabilitation center. But if she can swallow, if she passed the barium swallow test, why would she need a PEG tube? Why can't she eat? She doesn't swallow food. I see. Okay, I can see that. Okay, is she having speech therapy and speech pathology involved? Is there a dietitian involved? Right. How's she getting nutrition at the moment? Probably through a nasogastric tube. Why can't they continue with the nasogastric tube? Right. I do believe this is a matter of time. I know it's only been a few weeks, which probably seems like an eternity to yourself, Christopher, but you know, give it some time. Give this some time, please, and speak to a neurologist urgently. That would be my strong recommendation. She just holds it in her mouth. Speech there, but not every day. Speech had better luck with getting her to swallow food. Yeah, good. That's good. I think there's a lot there from what you're describing. You know, passing the swallowing test, kidneys are good, you know, no mention of anti-seizure medications, stopped antivirals, stopped IV antibiotics, you know, she's sitting out of bed. I think there's a lot there. It's probably just not quite there yet. They want her out to sniff next week. Do you want her in sniff? That's the question. Do you want her at sniff, you know, or do you don't want her to leave with a nasal tube? Yes, I thought they would not. Okay, so here's the question, Christopher. Here's the question. Would you prefer to keep her where she is, right, with a nasogastric tube, or do you want her to have a PEG, which is a surgical procedure, and then go her to sniff? I believe your mom needs neurological rehabilitation, not a sniff. That's what I believe your mom needs. Right? You want her home, but I don't think she's strong enough yet. Sure. Of course you want her home. Yeah, fair enough. Yeah. You could potentially do rehabilitation at home, but you would need the right support services around you. You know, you would need that. The option was not offered. Right, okay. I presume you are referring to neurological rehabilitation was not offered. Okay, if that wasn't offered, I argue they're not doing their job. After a stroke and her being slow, yeah, I bet they are very heavy-handed about next step to sniff. I bet they are, because they want her out. They don't really care about what your mom needs. They just care about getting her out. Right? I can see that. That's when patients go to LTAC from ICU with a trach. They don't care about what's on the other end. They just want to have patients out. It's the same here. That's why you need to speak to a neurologist, Christopher, because the neurologist can guide you with neuro rehab. I would strongly recommend that, to speak to a neurologist. Maybe they have been deliberately trying to keep you away from a neurologist so that you don't go, so that the hospital can get their way. I would absolutely insist on speaking to a neurologist before discharge if I was you. Absolutely. Don't play that game of going somewhere without your consent. Don't play that game, Christopher. No need for that. Right? Hospitals can't discharge you without your consent. Doesn't sound to me like your mom can give consent at the moment. So it is really up to you to make that call. I do believe you need to put your foot down for now. And I do believe you need to ask for what you want now that you have more information. I think they may be embarrassed that they didn't detect the stroke while in their care. Well, that could be perceived as medical negligence. right? I do believe, therefore, you have a lot of leverage. You have a lot of leverage there, I believe, right? So a lot of leverage there, Christopher. I would talk to the neurologist as a matter of urgency and put the transfer and put the PEG tube on hold for now. I tell you another thing, she won't go anywhere without a PEG tube. She will not go anywhere. Your biggest leverage point here, Christopher, is not to give consent to a PEG tube. That is your biggest leverage point. You have all the cards. You have all the cards in your hands if you don't give consent to a PEG tube. All the cards are in your hands. And if you've signed the paper already, that's fine. Just let them know you changed your mind. No one can force you. Okay. So I think you still have time. You still have time to get that sorted. Okay. You hold all the cards here, Christopher. You just need to keep holding them. You know, very important that you stay in control here. You know, if you've done any research about SNF, you know how that will end up like. You don't want that. I do believe your mom is in the right place at the moment, assuming they can determine the next steps, right? The next right steps, which is you speaking to a neurologist, start talking about neurological rehabilitation, start talking about that as long as that it's sorted, you will not give consent to a PEG tube, okay? And let them know they can't send your mom anywhere without your consent and without keeping her best interest at heart, right? I don't think that has happened, right? And don't be discouraged by your mom not waking up yet properly. It takes time. It takes time. It is a great pleasure, Christopher. I hope that helps you, and I hope that sets you off on the right path here. And if you have trouble, you know, just send us an email. You are a member, so just send us an email and we'll guide you further. Okay, nice to see you, Helene, and nice to see you, Miguel. I know you've all been part of the conversation here as well on other shows. Now, I need to wrap this up today. I need to go a little bit earlier today. Now, thank you everyone for joining the show and for all your questions. I really appreciate it. Now, if you have a loved one in intensive care, go to intensivecarehotline.com and contact us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership for families in intensive care at intensivecaresupport.org. There you have access to me and my team 24 hours a day in the membership area and via email, and we answer all questions intensive care related. You can also get access to the membership for families of critically ill patients in intensive care at intensivecarehotline.com and clicking on the link of the membership. I also offer one-on-one consulting and advocacy over the phone, via Skype, via email, via WhatsApp, Zoom, whichever medium works best for you. And I talk to doctors and nurses directly. I talk to you directly. I'll set you up with questions to ask, but it's much better if I ask the questions to the doctors and the nurses, because then they know you have someone on your team that understands intensive care just as well as they do. And I will help you to make informed decisions, have peace of mind, control, power, and influence fast. I also represent you in family meetings with intensive care teams, again, so that you have someone on your side that can walk you through it with the intensive care team step by step, so you're not taken advantage of and the intensive care team can't push their agenda. Now, if you want one-on-one consulting and advocacy with me over the phone, via Skype, Zoom, or WhatsApp, click on the consulting and counseling link on our website, or simply send me an email to support@intensivecarehotline.com. We also offer medical record reviews in real time, so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you're simply suspecting medical negligence. I do these YouTube lives once a week. usually on 10:30 a.m. on a Sunday morning, Sydney, Melbourne time, which is currently 6:30 p.m. on a Saturday, Eastern Standard Time, 3:30 p.m. on a Saturday, Pacific Time, 4:30 p.m. Mountain Time, 5:30 Central Time. Now, I want to thank you for your support. If you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, click the like button now if you like. Share the video with your friends and families, and comment below your questions so I can answer it on a video. And thanks for watching. This is Patrik Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.